Well, good morning, good afternoon, FSMA Friday friends. And though it's not quite the last Friday of the month due to the holiday, I'm excited to be here for this special FSMA Friday session to learn what the final FDA traceability has in it and how food manufacturers and processors can best prepare. Now, if you're just joining FSMA Friday for the first time, we're glad you're here. You've come to the right place to learn about updates and insights surrounding the Food Safety Modernization Act and to get expert advice on methodologies and tools that can help you consistently meet compliance. Now, this is an 8-year-long series, and it's brought to you by Safety Chain and the Acheson Group. But before we learn more about TAG and today's speakers, let's quickly get through a couple of housekeeping items. First, attendee mics are muted. We want to get through all of today's great materials, but we're leaving room at the end for Q&A. So all you have to do is enter your comments and questions into the webinar panel during the presentation, and we'll do our best to get through all of them. And if we hit the top of the next hour and we haven't addressed all the questions, we'll get back to you after the session. And yes, this presentation is being recorded, and we will be sending you the slides and the recording later today, so please keep a lookout for that. All right, let's meet today's speakers. I'm delighted to welcome back to the show Dr. Ben Miller and Eric Edmunds, who has brought us some dynamite presentations over the years, and I know that today's session is going to raise that bar even higher. So, gentlemen, welcome back to the show. I know we're really anxious to dive into the latest traceability rule updates, but it'd be really great if you can give us a little bit more about your background and tell us a little bit more about TAG.
Sounds good. Thanks, Jim. Good to be here. This is Ben Miller. I started my career as an epidemiologist at the Minnesota Department of Health back in the early 2000s. So I've been working on outbreak investigations all throughout my career, and then went to the state regulatory side, where I finished up my public career as the director of the Human and Animal Food Inspection Program at the state of Minnesota Department of Agriculture. Had a chance to work with IFT back in 2011 and 2012 on their Task Order 6, which really kind of formed the basis for what turned into this final rule, where we sat around a table in Washington, D.C. and came up with some of these concepts like KDEs and CTEs. And so it's interesting to see it finally 10 years later show up in this final rule. So excited to be part of this presentation today and answer questions and just bring folks up to speed, at least what we saw the FDA put out earlier this week in the form of its final, yet to be fully published rule on traceability. Eric?
Yeah, glad to be here. And so Eric Edmunds, I have been working with TAG for a little over 6 years, and I focus largely on regulatory and legal issues for the food industry. I worked in private legal practice for a little bit before joining TAG, and before that I worked with the state of Oregon and their food safety animal health program, and led a lot of the industry outreach when FSMA was, well, particularly when the first FSMA rules like preventive controls and everything were being proposed, and managed the rulemaking docket updating the state's laws to align with USDA and FDA regulations, and spent some time doing inspections as well. And that's been transferred into to help our clients here at TAG understand and comply with up and coming regulations like this one.
Well, great to have you here, gentlemen. I think we're going to dive right into some FSMA updates, right? And Dr. Ben, I think you've got the conch here.
I do. So I'm going to move us ahead and actually pass it over to Eric to take us through a few of these regulatory updates before we get into the meat of the presentation.
Sounds great. Thanks, Ben. Yeah, we just wanted to give some updates on some things happening in the regulatory world, and may provide some insight for things to expect. But the first bullet here, kind of big news for certain aspects in this industry. FDA completed the first pre-market consultation for human food using animal cell culture technology. So these are the cell-based agriculture growing meat in a bioreactor. I mean, they look similar to like how you're brewing beer, large stainless steel containers, but Upside Foods recently completed this consultation, and they received an FDA no questions letter regarding the safety of the product for their chicken products. And this is really it's the first one in the United States and the second one worldwide. The only other product approved previously was one out of in Singapore. So a big step forward for that industry. There's obviously going to be lots of things going on in the near future regarding labeling and a little how it's going to be regulated, because it's kind of an interesting one that it's a chicken product for this one, but it's shared responsibility between FDA and USDA, kind of differentiating between where it's harvesting and growing the cells versus further processing into your finished product. So a real interesting step, something to look into if you're interested in the cell-based kind of food tech world. And then the manufactured food regulatory program standards were updated by the FDA. And if you're not familiar with those are essentially the standards that the FDA holds states to when states are performing inspections on behalf of the FDA. So there's kind of different, a litany of things that they have to, it's the way the FDA audits a state inspection program. And so there's going to be some updates there, but just something to be aware of, largely for the regulators on that one. Then we just wanted to bring a little attention to this proposed regulatory framework for salmonella illnesses in poultry. So a little while ago, a few months ago, the USDA made some headlines by announcing that they were thinking about declaring salmonella as an adulterant in raw breaded stuffed poultry items, but they also just came out with this newer proposed rule to reduce salmonella illness in all poultry products. And that's going to be kind of a three-phase proposal, one involving testing birds and flocks coming into facilities, then kind of process controls at the facility, and then they're going to be looking at establishing more of a enforceable product testing standard for salmonella in all poultry. So potentially big change there, similar to really what the meat industry saw with E. coli a lot of years ago, but something to be aware of in the poultry industry if you're using any poultry ingredients. The next one, the Government Accountability Office is GAO, and they regularly assess executive agencies and kind of provide suggestions on what they can do to improve the services they're providing for the public. And if you've noticed, there's lots of things in the news about PFAS and food contact substances and things that potentially migrate into food. And it's an interesting area for FDA because historically, they don't have a whole lot of, let's say, regulatory power or enforcement ability over some of these. And so the Government Accountability Office is recommending that the FDA do two things. Number one, request more authority on food contact substances from Congress. And then secondly, kind of implement a timeline program where they go through all of the food contact substance approvals, and there's a very large number of them, and kind of evaluate when was the last time FDA personally evaluated this food contact substance for safety purposes. And they want to push FDA into doing more regular reviews of all food contact substances that go into packaging and processing equipment and things to verify that they're still safe for use regarding up-to-date current scientific principles. And the last one is more of an informational. The Food Safety Analytics Collaboration released the annual report from 2020 on foodborne illnesses and kind of what types of foods those can be attributed to. So fun reading for those who want to look into that a little bit more. Now we'll get into the meat of the presentation. I'll pass it back to Ben for a bit.
Thanks, Eric. So for today, we're going to run through the timeline for the rule, some compliance dates and enforcement dates, and kind of our enforcement strategy to begin with. Talk a little bit about the food traceability list. So these are the foods that have undergone a risk assessment by FDA and have been determined to meet a high enough threshold to be on this list, and then have the requirement for these CTEs and KDEs as they move throughout the supply chain. Talk some about exemptions, some of the key terms, traceability plan requirements, record keeping requirements, and then that availability and maintenance of records over time. So I will start us off just by way of background. If we remember that the proposed rule was published back in September of 2020. And so then everybody, I'm sure on this call, printed that out and read it multiple times and kept it under their pillow so that they knew everything in it. The final rule was published earlier this week. It's in fact still in an unpublished state until I believe next Monday. But you can certainly go and download all of the language that's going to show up in the final rule. And then FDA has put out quite a bit in terms of FAQs and things like that on their website. So a lot of what we're going to be talking about is the changes or the things that kind of came out of the difference between the proposed and final rule, and then some of the things that might show up on that FDA FAQ. So if we remember just what the purpose of this was, if you think back to 2011 when the Food Safety Modernization Act was originally passed, we were experiencing some significant large multi-state, especially produce-driven outbreaks, not uniquely though. I mean, you saw manufactured food-related outbreaks. Certainly I think about peanut butter, a large shell egg outbreak in 2010 that probably in some part drove the passage of FSMA and got it moving again in the Senate. It had sort of stalled in the House if we go back to 2009. But all of us to say that traceability was recognized to be one of the features that really needed to be thought about and improved in the supply chain, especially from a public health or outbreak investigation standpoint. So when I worked as an epidemiologist, both at the Department of Health and Department of Agriculture in Minnesota, we would get involved in these traceback investigations, and the quality of records really varied throughout the supply chain. At that time, some people were keeping very detailed records. Some people were really not maintaining any records at all, or very minimal records, basically what was minimally required by the 2002 Bioterrorism Act. So this rule, now 10 years later, is really meant to address those types of situations, and from a public health and regulatory standpoint, help investigators and industry get back to and understand what might be the root cause of some of these outbreaks, because oftentimes traceability exists, but not to the level of granularity that can get you back to a specific farm or a specific ranch or lot on a farm. And so the language and the requirements that show up in this rule are really meant to help address those type of situations. So they've established this food traceability list, which we'll go through here in a slide or two. And the rule applies to, as we have here, persons who manufacture, process, pack, hold foods that appear on the food traceability list. And so it's not just facilities. Persons can include companies, corporations, legal entities like that. So just wanted to call that out, that if you have responsibility for moving some of these commodities through the supply chain, it's not necessarily that it's facility specific. So that's just something to make note of. So if the rule applies to you in the supply chain, there's a requirement to maintain records, which are called key data elements, and those key data elements are associated with specific critical tracking events. So back in 2010, 2011, 2012, we were thinking about how do you design a system like this, and working on FDA's Task Order 6. One of the models that was looked at conceptually was HACCP, and so can we create a similar system to a HACCP-based system where you have critical control points and then you're maintaining records at key points in the supply chain in order to improve traceability overall. And so that's really where some of the structure and concept of this approach comes from, and that did make it through and show up in the final rule here. So the idea is that at certain points in the supply chain where you are required to maintain critical tracking events for the food traceability list foods, that you're able to make that information available to the FDA or regulators within 24 hours or some reasonable time to which FDA has agreed. So compliance for this rule will come January 20th, 2026. That got pushed back a year from the proposed rule, and FDA is going to be doing a little more in-depth webinar. I know they did a quick one earlier this week. They're going to be doing a more in-depth one in a couple weeks on December 7th. So which foods finally made it on this food traceability list? We've got cheeses other than hard cheeses, shell eggs, nut butters. Many fresh fruits and vegetables show up on this list, and then especially fresh cut fruit, and then fresh cut vegetables other than leafy greens. Fin fish, both fresh and frozen, and smoked fin fish, refrigerated and frozen. So a lot of seafood you can see shows up on the list as well. And then in addition to that, ready to eat deli salads, which are refrigerated. So one change from the proposed to final rule was an acknowledgement that if herbs or vegetables or fruits are dried or frozen, that they are now exempt from the FTL list. So that was a change, and I think questions had come up in terms of trying to interpret the proposed rule. Does freezing, is that a transformation event, or is that something that would change the requirement for a food to be on the FTL? And the final rule that did show up for those types of products. So there are many exemptions to this rule, which, when we think about traceability throughout the supply chain, oftentimes we would say that, traceability is kind of dependent on the weakest link in the supply chain. And at the same time, I think the agency recognized that requiring this level of record keeping from very small entities within the supply chain was perhaps not realistic. So there are exemptions that exist for farms and the records that they have to maintain. There are exemptions for facilities or persons receiving food of certain types for processing. So if that food goes through a kill step as a transformation event, you no longer have to maintain traceability records farther down the supply chain, or if you have contractual agreement throughout the supply chain between the shipper and the receiver that product will subsequently receive a kill step, records are not required to be maintained then in those instances as well. And I suspect that FDA will likely go into more detail in terms of what that looks like, or that partial exemption looks like, on their December 7th webinar. So produce that's rarely consumed raw, so things that you typically would not eat raw, are also exempt. USDA regulated food, commingled raw agricultural commodities, except for fruits and vegetables covered by the produce safety rule. Small retail food establishments and restaurants. So that was something that had been updated from the proposed rule. Originally, the proposed rule was thinking about different ways to exempt retail food and restaurant establishments, and they were thinking about, do we look at the number of FTEs? What they finally came down with was if you sell less than $250,000 a year of food over a 3-year average, just using January 2020 as your inflation based starting point, that you are exempt. And that would apply per location, not per chain. So if it's a chain establishment, or the retail food establishment, it would apply to the individual, like physical establishment itself. All right, and we'll go to the next slide. More exemptions: farm to school and farm institution programs, owners, operators, or agents in charge of fishing vessels. So a lot of the traceability under the final rule picks up at the first point of receiving, so the first land-based point of receiving for fishing vessels, or the first packing or cooling shed for harvested produce. So that's a little bit of a change between the proposed and final rule. It also does not cover transporters, nonprofit food establishments, food for personal consumption, persons who hold food on behalf of specific individual consumers, or food that's going to be used solely for research purposes or evaluation. Let's talk a little bit about some of the key terms. So we have this concept of critical tracking events, and those are specific events that occur in supply chain. And right now we have harvesting, cooling before initial packing of a raw agricultural product other than food obtained from a fishing vessel. Again, that first land-based receiving of a food obtained from a fishing vessel, shipping, receiving, and transformation of food. So there's a little bit of a difference in terms of, again, what was in the proposed rule. The proposed rule talked about having a creation critical tracking event. So that would have been, when product was received at a cooling shed, or first land-based receiving. So that was kind of the creation of the food. Or if you were combining a number of ingredients that weren't on the food traceability list into a product, so like let's say taking peanuts and oil and making peanut butter, that would have been a creation event. Right now, under the final rule, that would be considered a transformation event. And so even if you have foods that don't by themselves show up on the food traceability list, if they're transformed into a product that then is on the food traceability list, like nut butters or peanut butters, that's usually the predominant example that we think about, then that food does become a food that shows up on the food traceability list, and critical tracking event and key data elements need to be maintained from that point on and forward into the supply chain. I believe I'm going to turn it over to Eric here on this next slide. And
sounds good. Thanks, Ben. Yeah, so as we were mentioning, so critical tracking events, the events along the supply chain that require records, and these key data elements are the records that are, or the information that is required to be included in the records. So thing I want to draw attention to here, we kind of listed some examples of the common types of information that needs to be included, but the KDEs and the rule really outlines quite clearly for each event what you need to include. So the important aspect from an industry perspective here would be to really look and see which critical tracking events apply to your operations, and then look at the list. So for this slide, we really just summarized generally what you're looking at and what may be included. So it'll take a little bit of more digging to see specifically, but it is outlined fairly well in the rule. We just didn't want to repeat ourselves over and over again through these slides. So traceability lot codes, we'll get into that a little more in detail on the next one, but that's essentially the lot code that's going to be following the product that's on the food traceability list through the supply chain. And then product descriptions, quantities, and units of measure. So when you're shipping something, you typically have to say, oh, I shipped 6 cases of this product, or 200 pounds, whatever the unit of measure and quantity would be. And the product description is going to be the overall product name or variety, just so there's a clear description that's following it through the supply chain as well. Dates are going to be really important for any of the critical tracking events that FDA wants to know exactly when things were harvested or cooled, shipped, received, when production happened to transform something into a new product. And that's really just going to help them with particularly in the event of like a recall investigation or a foodborne illness investigation, really identifying exactly where the contamination may have happened and when it may have happened to facilitate a quicker trace back or even trace forward investigation to get products that may be unsafe off the market quicker. Location description is an interesting one that has changed slightly, largely in relation to what farms and really fishing vessels are required to record and pass along. So location description is going to potentially apply to the harvest area of a fishing vessel, the growing coordinates of the farm. If you're in aquaculture or something like that, they actually want the location description to be as specific as the container or pond in which the fish or seafood were grown at your facility, and those have to pass through. And so if you're receiving from any of those, you're gonna have to keep location descriptions in your records that exactly correlate to the records and names that the farm or aquaculture operation or fishing vessel uses for where they're harvesting the product. Reference document types and reference document numbers. So one of the big features of the rule in general is that the underlying statute basically said you can't make industry create duplicitous programs, and they do recognize that for most of these KDEs, the records and the information is already available on paperwork that's being passed through the supply chain, or at least one up, one down scenario where you can get that. So things like bills of lading or purchase orders, or in a processing facility, your production records likely have a lot of this, if not all of this information already included. So instead of creating a completely new program, you can actually just name the types of documents and their reference numbers to kind of correlate those with your overall traceability plan, so FDA can review in that way. So doesn't necessarily require new programs, but you have to be able to organize all the information on your current documentation. So I'll get into that a little bit more later. The interesting thing here that's a little bit of a change from the proposed rule is this reference document numbers. And that's really just, they don't just want to say, oh, we have production records or we have bills of lading that have this information. They do want enough information gathered that they can get to those reference document types easily and quickly without having to sort through potentially years worth of documents. That it's a quick reference there that they can look at, or you as a company can review. So I said we'd get into traceability lot code, and as you see from the regulatory definition in the rule, it sounds a lot just like what we call a typical lot code or production lot or production code. So descriptor, often alphanumeric, helps identify the traceability lot. The interesting thing about this is that for these events when the traceability lot code must be assigned, and if you see at the bottom there, the three categories when a traceability lot code that's subject to this rule are going to be required are when you initially pack a raw agricultural commodity, not from a fishing vessel, when you perform the first land-based receiving of food from a fishing vessel, and when you transform food. So those will be the initial creation events for a traceability lot code, and that traceability lot code needs to follow that product through the entire supply chain until it's either transformed or shipped or sold to the actual consumer of the product. And that's there because if we look at it, they don't want you creating new traceability lot codes if you just receive and ship a product without a transformation. They want that there. So if, let's say, a retailer has a product that's passed through 5 steps in the supply chain, whether, production, distribution, further distribution type of thing, they can actually jump steps to see where was the last time this was actually processed, because that's the most likely point that it would have been contaminated. So they can jump back and not have to go step by step through the supply chain. And what the interesting part here is, you also need to pass along this traceability lot code source. So the place or person that actually assigned the traceability lot code. So there's some concerns there from an industry perspective, because you don't necessarily want to identify all of your suppliers and have that information go all the way down the supply chain. So just from a kind of confidentiality supplier standpoint, so the traceability lot code source, you don't have to necessarily name the company by name. You can provide kind of a lot code source reference. And what the FDA has said in the final rule about that is that could be like the FDA registration number, or even a website that they'll be able to go to identify or figure out who created the original traceability lot code source, without making it so, I guess, obvious and out there for the entire supply chain to protect businesses' confidential records and information in that sense. So the overall idea of the program, that where you'll start, is this traceability plan. So FDA likes having regulations that require plans. So now you'll have your food safety plan, your food defense plan, and your traceability plan. And the traceability plan is pretty straightforward. It's really just a summary of how you're assigning lot codes or how you're tracing product through the supply chain, and descriptions, so the FDA could look at that and understand your records without having to do a lot of back and forth in the event of an investigation or recall. So generally, descriptions of how you're maintaining your records and the format. So you may list, oh, we keep production records on our production records, and this is where they're located, and this is where we store them, as well as kind of how you're applying or creating traceability lot codes for anything that you pack or hold. And then jumping into a point of contact is actually going to be a key feature there, that if these descriptions and explanations aren't adequate and the FDA needs someone that they can work with, the person that's going to be the FDA point of contact for records or for investigations to make sure that they're understanding exactly what the overall production supply chain traceability records are saying. There we go. Okay, and then the next one is the first bullet point largely applies to farms and fishing vessels and aquaculture operations. That in the proposed rule, farms had a little bit more requirements that they could have potentially assigned the traceability lot code themselves, and there is a definition of a first receiver, and it was a little bit confusing and difficult to follow. So the FDA eliminated that, and largely farms are just going to need to keep, or first create a map that has locations and names, potentially GPS coordinates of the areas where each food is grown or raised, and pass that information down to the person or entity that's going to be packing the product, so they can keep that in their production or packing records. And as I mentioned earlier, for aquaculture, containers, ponds, whatever specific area those products are being raised in is gonna satisfy the general map requirements. Now, for this one being updated, there's not a timeline like you do with the food safety plan or some of the other FDA requirements. It's just updated as needed to reflect current practices for your documentation. And so if you ever have any changes in the way you're assigning traceability lot codes or changes in the way you're documenting production or packing, that's when you're going to have to update your traceability plan, because really it's just a description of how you're doing those things. So the one thing here is just with the fact that food can be on the market for a while for a lot of these, the previous traceability plans, after they're updated, just need to follow the same record keeping requirements as most FDA rules. You have to keep them around for 2 years, so the FDA or you will be able to reference back to those in the event of an investigation. So just to provide a quick summary and some ideas of the general record keeping requirements. So you have your food safety or your food traceability plan that has the general descriptions, and then you're going to be keeping all those records. Paper, electronic, or true copies are allowed. So true copies being things like a photocopy that are there. These don't necessarily need to be kept on site. That you can even hire a third party to maintain your records, as long as those are going to be able to be provided to FDA within this allotted timeline. So when FDA does request your records, they're expecting to receive them within 24 hours or within some reasonable time to which the FDA has agreed. So that's very subjective and will be kind of situationally dependent. So generally, you just have to think about, well, we'd have to provide all of our traceability records within 24 hours. And with that, you'd also be submitting your traceability plan, where you're going to have the explanation so FDA can understand your records, and that'll include that point of contact information. So if FDA has questions, they'll be able to look into that. So the next one is kind of this situation within a situation that is pretty broad, actually. So when necessary to help FDA prevent or mitigate foodborne illness, assist in implementation of a recall, or to otherwise address a threat to the public health. So this is when, and this did not change from the proposed rule in terms of what they're requesting. When there's this potential public health issue, you have to provide all the records and they'll provide in their request kind of, we're investigating this product within this date range, provide us all the records for those. You'll have to provide all the records in an electronic sortable spreadsheet. And this is, I mean, we talk about FDA and kind of the new era of smarter food safety, and this rule in particular falls into this tech-enabled traceability function that the FDA is pushing really hard, that they're not allowed to require you to keep electronic records, but in this instance, they are requiring that you submit an electronic form to expedite any investigation that may be occurring. And the standard that's being used for this, the otherwise to address public health, is when FDA has a reasonable belief that there's an issue that's implicating a public health problem. So you can expect that this will be used readily if FDA has any inkling that there is a food safety issue afoot. So be prepared for that. I would like to add that there are some exceptions that we didn't get into all the details on this slide for farms, retail establishments, and others. Or they actually use the term persons in the rule, so generally applicable to everyone. That they would not have to require, or they would not have to submit an electronic sortable spreadsheet. And this is based on annual sales combined with the value of food that's held without sale or manufactured without sale. So for farms, they're kind of looking at the general 250,000 category. And for retail establishments, restaurants, more the $1 million category, as well as $1 million per year. And as with the previous one that Ben mentioned, this is averaged over a 3-year rolling basis. And I'll touch basically on the retail establishments, because Ben mentioned that the small retail establishments and restaurants are totally exempt from the rule when they have less than $250,000 in annual sales. But if they have less than $1 million in annual sales, they're actually just exempt from this sortable spreadsheet requirement. And the rule goes into a kind of in-depth analysis over, based on those sales numbers, how much of the industry may be exempt, and they kind of balanced the economic burden on these facilities with the need and kind of the volume of sales and food production that these places do, to make sure they're not just going to be missing huge segments of the industry. And those are the numbers and general idea that they came up with for those issues. So just to wrap up with a bit of a summary before we go to questions. The compliance date, January 20th of 2026. That's been extended by 1 year. The FDA originally proposed 2 years and moved it to 3. And that's for everyone, regardless of the size of the operation or type of operation. And that's really just because if there's one missing or weak chain, or in weak link in the chain, the whole traceability program falls apart. So they really want everyone to be complying at the same time, and it's somewhat useless to have one company doing it and not another that may be interacting along the supply chain. So one solid compliance date for everyone. And Ben went through the summarized examples of all the exemptions, and there are a lot of them. And some of them are related specifically to this idea that the rule is covering persons instead of facilities. So that the thing about personal consumption isn't something you typically see, but FDA has created a useful tool that's available on their website that basically just runs through a series of questions and helps you determine if one of these exemptions applies to you. And as always with all the FDA rules, that they've kind of really emphasized this idea that they're going to be educating before and while they regulate. So expect a lot of educational opportunities up until January 2026. After that is really when we'll probably kick into regulation overdrive. But the FDA is going to make a real serious effort to get education and help people understand the rule and their specific requirements. And as we mentioned, in December 7th, they're planning basically a half-day webinar to go over things, and they already have some pretty good resources available on their website. And TAG, we'll be out following everything and providing updates and webinars as well. So stay tuned for that. And then really for the KTEs, critical tracking events and key data elements, we're looking at specific requirements for each different phase. So if you need help understanding those, we're here for that. And the rule does outline them really well. And the last thing that I just wanted to say is this 24-hour turnaround time for records requests from the FDA is going to be the kind of slight difference from a lot of other rules that just provide reasonable time, or they'll actually be on site. Some of these may be done electronically or just via email requests. So having the ability to turn around those records and get them shared with the FDA within 24 hours is going to be a bit of a hurdle for some companies. So start thinking about how you're going to be addressing that turnaround time.
Yeah, that was one of the big points I circled in my notes. 24 hours to comply with records. Gentlemen, this was amazing. This was a really good kind of overview of what we can expect. And yes, as we said, December 7th, there will be a webinar with the FDA, which will go into some pretty good details. All right, so yes, lots of questions are coming through here. One point I wanted to make, and this is something Eric brought up here, instead of completely creating a new program, you can just name documents like bills of lading. You have to provide enough information for the FDA to know how to get to those documents quickly. So this goes back to your point. If you can potentially digitize your process, you can supply that information a lot quicker. So I'm getting a lot of questions here around how do we is there a standard template to use, or is there a standardized process or standardized data sets that the FDA is recommending to ensure that, we can comply within that 24-hour time frame?
I mean, that's a great question. I'll start off, and that's kind of the whole idea of the rule. So data transparency and everything, they've created the terms and the specific records that are required for each of theirs to kind of create consistent terminology across the industry. And so while there's not a true template, the rule does outline the specific requirements for each step along the supply chain when you're dealing with one of these food traceability things. So, but in terms of this is the document you should be filling out, it's not there yet. It'll be up to you to organize those kind of within your current existing programs.
Yeah, I'll tag onto that. Like Eric said, the rule is there to define what the specific KDEs are for each critical tracking event type. So in Eric's slide, he covered the ones that apply to all critical tracking events, but there are KDEs specific to each critical tracking event. So, when we go into more detail on that in subsequent webinars, and I'm sure the FDA will touch on that more too in their December 7th, depending on how much detail they get. That was always, I think, one of the sources of, I don't want to say frustration, but just in sort of industry trying to think about how do we comply with this? Would it just be easier if the agency picked a standard and a data standard and said, go with this? Certainly there are initiatives out there like the PTI, the Produce Traceability Initiative, that relies pretty heavily on the GS1 data standards in terms of, passing data throughout the supply chain in a way that's interoperable, and that, the same kind of key data elements for similar fields are used throughout. But I think that's going to be a little bit of a challenge, is that we don't see a requirement in this rule for standardization around how data is to be exchanged. So, I can still call something, a pink tomato, and farther down the supply chain, it might change names to something different. And so that's really, again, why the agency has emphasized the maintenance of that traceability lot code up until the point that the food is either sold or transformed into something else. And yeah, it'll be, the devil's always in the details with these kind of things. And I think that's going to be one of the primary areas of challenge, is getting that to mesh up in a way that works throughout the supply chain.
And yeah, making sure that all of your suppliers and processors are sending the updated information. So lot codes can change, right? And that needs to be cascaded throughout the whole supply chain. Okay, thank you guys. Under the point about transforming food, so do you have to keep records every time a new ingredient is added?
I think I can start off with that one. So it's not and we didn't cover this in detail there, because previously in the proposed rule there was creation and transformation, which were kind of two different things, where this one, anytime you're dealing with an ingredient on the food traceability list or creating something that's on the food traceability list, there's two sections for that. So there's the incoming ingredient record requirement and the outgoing product record requirement. So they're kind of lumped into two categories where, have required KDEs for all the incoming ingredients, as well as required KDEs for the outgoing finished product, not for necessarily individual ingredients, but it'll be one record that includes all the ingredients going into a product.
Got it. Okay.
Yeah, and I could.
Oh, go ahead.
I could add example to that one, because an FDA did address this on their FAQ for under transformation. So the example that they use is if you're making like a deli salad that includes tomatoes, cucumbers, and olives, well then you have to maintain the receiving records for the tomatoes and cucumbers because they're on the food traceability list as incoming ingredients, but not the olives. But then you would maintain obviously the KDEs on the final product, on the deli salad, as part of that transformation event, and then going forward, further down the supply chain. So there's a lot of nuance in terms of sort of what records need to be kept for which ingredients and which foods, depending on kind of what steps occur in the supply chain. And again, is there a kill step? Is there not a kill step? What's the definition of the product, et cetera?
Okay, guys, how about foreign growers or suppliers? Do these new rules extend to them?
They do. So some of the requirements for like locations and everything, the way the rule kind of addresses it, if they don't have the same kind of street address topics of that exist in the United States, is they just generally lump them into or something equivalent in that area. But yeah, anything that's coming into the United States, you're going to have to keep traceability records, and it's going to follow along the supply chain no matter what. So for farmers in Mexico growing fruits and vegetables that may be on the list, those will be required, that are going to pass through the supply chain until they get into the States for whether it's direct sale or food processing. That it's kind of generally applicable. So just like the FDA requires foreign establishments to register with the FDA, they will be required to keep these traceability records and pass them along the supply chain according to the shipping critical tracking event and KDEs associated with that.
Okay, so that 2026 deadline still applies to those foreign suppliers as well.
Mm-hmm.
Okay, great. Lots of questions here. Ben, I think you mentioned this earlier, but frozen vegetables, frozen fruits, maybe freeze-dried or what have you, those are exempt, is that correct?
Correct. Those are not on the food traceability list, foods under the final rule.
Okay.
Yeah, so I'll add a little something to that. That's one thing that was, I mean, it's not a change, it's really a clarification from the proposed rule. They had already done one clarification during the proposal period, that they've added, fresh or fresh cut or frozen, smoked, for seafood anyway. Those are very important, because the first step in determining if this rule applies to you is, are you handling the food on the food traceability list? And since those certain categories, they're really specified as fresh or fresh cut, and doesn't include the frozen category, that's the initial question. If I'm handling frozen sliced strawberries, frozen fruits are not on the list. So you're kind of can take yourself out of the requirements immediately by saying, we're not handling a product that's on the list.
Okay, fair enough. One question came in here, if, and maybe this is kind of something that needs to get into a little bit more detail here than we have time for, but if you are compliant with an existing program such as the Seafood Import Monitoring Program, would that essentially mean that you are compliant with this new traceability rule?
I am not sure on that one. I'm not familiar enough with the C4 that program to say whether or not all of the requirements perfectly align. The way typically that the FDA addresses this sort of thing is, just because you're in compliance or following an independent standard does not mean you're automatically, you can't say, well, I'm doing this, so I'm in compliance with that. That you actually have to do the verification to make sure you have all the same records. In a lot of instances, you may have all those records there, so it'll be a a very small step for you to get into compliance with the food traceability rule, but you would have to do an assessment to assure you can't just rely on participation in a third party or independent program to say you're in line with this.
Yeah, I think that's a good answer. Nothing to add from my part.
Oh, Denise just came in. Freezing is not a kill step for bacteria, so what is the reasoning for exempting frozen produce? Great question, Denise.
I'll start on this one because I totally agree with you. The way the FDA kind of went about creating the food traceability list, they went through lots of data and analysis saying what are the products associated with foodborne illness outbreaks and the likelihood, the severity, and that's just the conclusion that they came to, that it's not going to be required because the frozen aspects haven't been directly associated with these outbreaks. So I agree that the risk may be the same, but historically for investigations and outbreaks that they just haven't been as directly associated, it's the way the FDA's decided to implement the rule. So it's a very good question that a little difficult to answer from a risk prevention standpoint, but from a historical outbreak standpoint, that's the way the data kind of led the FDA.
Yeah, the only thing I would add to that is that, the agency is indicating that it'll revisit this list once every 5 years, or depending on how much time they have, so that they're not committing to 5 years per se, but based on resources to reanalyze the food traceability list about every 5 years. So, there will be some movement likely of commodities off and on that list, depending on what we see from, an outbreak and public health standpoint.
Ben, you mentioned earlier that one of the reasons why this update exists is because it was kind of difficult to track back to the plot of land or the farm. The question that came in was around how are people essentially able to do that quickly today if there's lots of, we'll just say, more manual processes, or we'll say non-digital processes happening. What's any advice that you can give folks to essentially get back to that lot?
Yeah, honestly, where it would typically break down in supply chain tended to be in two places: in distribution, and then where you had commingling of commodities, at the point of harvest or cooling or packing. And so, this rule tries to address, I think, traceability in both of those settings. In terms of manual data capture, that is going to be a challenge. So for smaller entities, being able to document, what harvest goes into which pack, and assigning a traceability lot code at the appropriate critical tracking event. And FDA earlier this year, or last summer, I guess it was, did a contest in terms of trying to identify technology providers that were essentially kind of low threshold technology providers to help with traceability. And I think that's on their website in terms of companies or entities they identified that had come up with creative solutions to really address that. So, if people have questions about what that could look like, and for smaller producers, I think FDA has that on their website. Probably find it through Google fairly quickly, but those are the points in the supply chain that were and are kind of traditionally where traceability broke down, as well as a retail. I mean, just from a epidemiologic investigation standpoint, trying to understand what specific lot of product did a consumer purchase. And this rule doesn't necessarily guarantee that we're going to get better visibility in that way at the retail setting.
No, I get it. And obviously, I think, as you mentioned, this will get reviewed every 5 years and updated in terms of what might be added or exempted from the list. It looks like we're just about out of time. We do have some other questions, so we'll definitely follow up, but I wanted to leave everybody here with some additional resources. Of course, Ben, Eric, thank you so much for giving us this overview. Certainly want to have you both back to talk about some of the new updates after the December 7th webinar. That would be amazing. Please check out the Acheson Group. They have lots of great resources, and of course, you can contact Ben and Eric separately. Safety Chain, we are a plant management software solution. Please go to our website. We have a ton of resources there for you around FSMA compliance and anything you need to know to unify production, quality, food safety, you name it. It's on safetychain.com. I'd like to wish everybody a very happy Thanksgiving. If you're here in the United States, have a great weekend. And again, look forward to talking to you on the next FSMA Friday. Thank you, everyone.